Hello friends, hope you all are doing great. Today I am going to discuss with you question number 5 of Katherine Anderson from mrcog part 1 book. Previous 4 questions I have discussed in detail in my previous lecture. Before starting, if you have any question you want to discuss from anatomy module, as we have started anatomy, you can post that in comment section. I will answer your question. It may take some time because of my busy schedule, but I will, inshallah. Now let's start. The question is with regard to veins of the pelvis. Options are: left ovarian vein drains directly into the inferior vena cava. First option. We should now go through some detail regarding ovarian veins and then answer this question. So ovarian vein also called female gonadal vein, carries deoxygenated blood from its corresponding ovary to inferior vena cava or one of its tributaries. Ovarian veins originate from pampiniform plexus in the broad ligament near the ovary and fallopian tube and communicate with the uterine plexus, then course anterior to the psoas muscle and the ureter. This is important point. This is the diagrammatical presentation. Number 1 shows ovary, number 2 are tertiary follicles, number 3 is ovarian ligament, number 4 is fallopian tube, and number 5 shows ovarian artery and vein. Now right ovarian vein directly drains into inferior vena cava, while left ovarian vein directly drains into left renal vein. From there blood goes to inferior vena cava. It is the female equivalent of the testicular vein and is the venous counterpart of the ovarian artery. This is the diagram showing left ovarian veins draining directly into the left renal vein, while right ovarian vein directly drains into the inferior vena cava. Ovarian vein syndrome. It is a rare condition in which a dilated ovarian vein compresses the ureter. As mentioned previously that ovarian vein crosses anterior to the ureter. Okay, so the dilated ovarian vein compresses the ureter. This causes chronic or colicky abdominal pain, back pain and pelvic pain. Pain worsens on lying down between ovulation and menstruation. There is increased tendency towards UTI or pyelonephritis. Right vein is most commonly involved, although it can be left-sided or affect both sides. It is currently classified as a form of pelvic congestion syndrome. As mentioned earlier, right ureter compresses more than the left one. It is because right ovary is a bit lower than the left one because of the presence of liver on the right side. So there is less space and right ureter has more chances of compression from right dilated ovarian vein. So let's come to the question. The first option was the left ovarian vein drains directly into the inferior vena cava. This is wrong because the left ovarian vein drains into the left renal vein, from where blood goes to the inferior vena cava. Now, second option is the internal pudendal vein passes through the pudendal canal. Now internal pudendal vein. The internal pudendal veins are a set of veins in the pelvis. They begin in the deep veins of the vulva, issuing from the bulb of the vestibule. They are the venae committantes of the internal pudendal artery. Venae committantes basically are pair of veins alongside their corresponding arteries. It is enclosed by a pudendal canal with internal pudendal artery and pudendal vein. They unite to form a single vessel which ends in the internal iliac vein. So the internal pudendal vein passes through the pudendal canal, it's true. Now C is the uterine venous plexus connects the ovarian vein and the vaginal venous plexus. So uterine venous plexus, it lies along the sides and superior angles of the uterus between the two layers of broad ligament and communicate with the ovarian and vaginal plexus. From the lower part of the plexus opposite the external orifice of the uterus arises uterine veins and open into corresponding hypogastric vein, then into internal iliac vein. Now this is the diagrammatic presentation. You can see that uterine venous plexus at the lower end forms uterine vein which then drain into the hypogastric and ultimately into the internal iliac vein. So the question was, the uterine venous plexus connects the ovarian vein and the vaginal venous plexus. It's true. The internal pudendal vein drains into the great saphenous vein. As we have discussed previously that the internal pudendal vein drains into the internal iliac vein, so this option is wrong. It is the external pudendal vein which drains into the saphenous vein. The rectal venous plexus is the site of portocaval anastomosis. Now, rectal venous plexus, also known as hemorrhoidal plexus surrounding the rectum, consisted of an internal and external rectal plexus drained by superior, middle and inferior rectal veins. It forms a portocaval anastomosis. This allows rectally administered medication to bypassing first pass metabolism. This diagram showing internal rectal plexus and the external rectal plexus. The veins of the hemorrhoidal or rectal plexus are contained in a very loose connective tissue so that they get less support from surrounding structures than most of other veins and are less capable of resisting increased blood pressure, resulting in hemorrhoids formation. Here you can see hemorrhoid formation on the left side. You can see normal veins of the rectum, internal and external, and on the right side you can see there is a internal hemorrhoids and also the external hemorrhoids. Now, internal rectal plexus, it is present in the submucosa of the rectum and proximal anal canal at the anorectal junction. The internal plexus presents a series of dilated pouches which are arranged in a circle around the tube immediately above the anal orifice and are connected by transverse branches. The internal rectal plexus may prolapse into the anal canal to form pathological internal hemorrhoids. These are often strangulated by the contraction of the anal sphincter, causing ulceration and bleeding. As I have seen previous slide, you have seen the internal hemorrhoids. In this picture you can see internal rectal venous plexus in submucous space. External rectal plexus, it is situated outside to the muscular wall and an internal rectal plexus. The external rectal plexus may be affected by blood clots, thrombi, resulting in external hemorrhoids. These are the external rectal plexus outside the muscular wall, and this is the picture of the internal and external rectal hemorrhoids. Now, portocaval anastomosis, also known as portosystemic anastomosis. It is the collateral communication between the portal and systemic venous system. Portal venous system transmits deoxygenated blood from most of the gastrointestinal tract and gastrointestinal organs to the liver. It provides an alternative pathway for the blood. When there is blockage of the portal system, it enables the blood to still reach the systemic venous circulation. What are the sites of portocaval anastomosis? Lower esophagus, splenorenal, rectum, retroperitoneal via the vein of Retzius, umbilical and paraumbilical, berry area of the liver, omentum. This is the diagrammatic presentation showing all seven sites of portocaval anastomosis. Now the question was, the rectal venous plexus is a site of portocaval anastomosis. It's true. Thanks for watching. If you like my video, please subscribe my channel and click the bell icon for more updates. I will discuss further MCQs in my upcoming videos.